Good afternoon, friends. Tracy Kay here with eXp Realty. I'm here at my office in Englewood, the Broadway Collective. Today, we are featuring my dear friend, health insurance connoisseur, Adofo Ghani. We're going to talk about some of those burning questions that you have when you're trying to navigate through life transitions and then navigate the insurance market. So I'm really excited you're here because this is one of the most confusing topics I think people encounter when they're going through these major life changes. So all the things, divorce, downsize, relocating. So this is gonna be a really good chat. So I'm excited. So thanks for being here.
Yeah, thank you for having me. Tracy, it's good to be here.
Yes, can you tell me just a little bit about yourself, what you do, how you help people?
Yeah, absolutely. So again, my name is Adofo Ghani with Wisewell Insurance Group. And I help people navigate their healthcare through life transitions. And what that means is particularly people going into Medicare or even in having an ACA plan or having a job with employer insurance, retirement timing, and income planning. Those are all integral into how you choose your Medicare plan or how you choose your under 65 plan. So I help people actually strategize and navigate that space.
What are some of the major life transitions that you typically focus on, or what are kind of the top transitions you see? Retirement, or when you're looking at these plans?
So if we're looking at, again, I handle people who are under 65 and over 65. So for the under 65 market, it's usually a loss of employment. I'm working around with an attorney group right now that has a lot of individuals who are receiving settlements, but part of that settlement means you have to leave your job.
Right.
So they need health insurance. Individuals who are getting married, I had a couple who just recently got married, and so they are looking on getting health insurance together.
Sure.
So any kind of life transition point like that, even individuals who have had a loss of spouse or partner, helping them navigate that space as well. Moving, a lot of people move to Colorado and need health insurance. So my phone is always ringing for that.
Yeah, super important. Like I said, these are questions that I know I can't answer. A lot of my clients come to me about it, especially when they're relocating, and I got to get them to the expert, the person who understands the nuances. So everyone's always curious about your why. So what drew you to this space, health insurance in particular, because it is so complicated, particularly working within Medicare and Medicaid?
Yeah, I actually have a personal story for why I do this work. I was actually helping my great aunt, and I wasn't in the insurance business at this time. I was just visiting her. She loves to feed me. And I went to see her one day, and she has this dining room table that's twice the size of this table we're on today. And it's just full of junk mail. And she's distraught. I'm like, Auntie, what's going on? And she's like, the calls are coming, and I don't know what to do, and I got all this mail. And I was just like, it'll be okay. Let me go through it. And I literally read through every piece on her table and got rid of the junk mail, got to what her actual plan was, then got on the phone and on her behalf spoke to her plan, got all of her questions answered, and she's feeding me, and
You need
she's
fuel
like,
for
yes,
these conversations.
It was a couple hours too.
Yeah.
It wasn't. I've synthesized it. I mean, it was a lot more work than it sounds. But at the end, she's like, nephew, let me ask you a question. I'm like, what's up, Auntie? And she's like, why aren't you doing this for other people?
Wow.
She's like, this was such a great help to me. And it was an interesting time in my life because I had just moved back to Colorado, and I grew up here. I'm a 4th-generation native, grew up playing basketball in all of these rec centers, and it got me thinking that this would be an opportunity to come back and give back to a community that I had been enriched by. So that's what got me going, and it's my passion and purpose to help individuals.
That's amazing. I love that story. How's Auntie today?
Well, Auntie is in heaven.
Is in heaven. Okay, I'm sorry. Yes.
No, that's a good thing.
But she went to heaven with all of her coverage. She knew it all. Yes.
Actually, you know what's interesting? Yes. She actually passed away at 95 on no medications.
That's amazing.
None.
Yeah.
And a month before her 96th birthday. And so, no, she's had a very blessed life.
Yes. And she was taken care of on the insurance side.
Absolutely.
Yeah.
and the catalyst, because,
That's great.
Yeah.
What are some of the, what are the biggest misconceptions about Medicare specifically?
Yeah. The biggest misconception around Medicare is that Medicare covers everything.
Right.
People think that once they get to Medicare, they're just going to be taken care of. So that's probably the biggest one, because Medicare doesn't cover everything. Medicare is a health plan. It's a great health plan once you get there.
Sure.
The other misconception is that Medicare covers long-term care and custodial,
Right.
and it does not.
Yeah.
It covers up to 100 days of skilled nursing, if approved. But that's a lot of financial and emotional pressure on a family.
Right.
So those are definitely the biggest ones, along with that choosing a zero premium plan in Medicare means you're going to have the lowest cost.
Yeah.
And that's not necessarily true.
Wow. Okay. I do a lot of work with seniors in particular, and that is the misconception. They think, well, Medicare will just take care of everything. So that's why I trust you as my resource when someone is downsizing, going into assisted living, skilled nursing, what really is covered, what it's amazing to have you as a resource in that world, because they think that everything's going to be taken care of, and that's not necessarily the case. So at what point should someone actually start planning for Medicare?
Well, I work with individuals mainly over 50, and because I'm a National Social Security advisor, we're able to talk about conversations around Social Security as well. But the earlier the better, and it just depends on where you are on the transition. Because if you're turning 65, well, you want to start looking at around 6 months before you turn 65. You have 3 months before you turn 65, the month you turn 65, and 3 months after as a window.
Okay.
But you have people in our community, right, in our culture today, we're working over 65. And that becomes a little bit more strategic, because you may enroll in Part A, which is, half of the Medicare conversation, right?
Right.
But you don't enroll in Part B until after you leave your employment.
Okay.
And so that's a strategy in there, because if you enroll in Part A, then you take away some opportunities. Again, working with individuals going into Medicare, you have an opportunity to continue to put money into your HSA, as an example, until you turn 65. But once you enroll into a Part A, it cuts that off. So it requires some strategy.
Some strategic planning,
some
absolutely.
Strategic planning, exactly.
Yeah. What are the most common mistakes you see when people are choosing a plan? Or maybe they made a mistake before, and when they come to you, you're kind of helping clean up the mess. So what maybe the better question is, what are the messes you see that you have to maybe clean up, I guess?
I think the biggest mistake, or error or mistake, is choosing a plan just because of premium.
Right.
That can be a mistake for many reasons, because just because it says zero premium, again, like I said before, doesn't mean it's the lowest cost plan. You could choose zero premium and end up paying thousands of dollars for healthcare.
Right.
So that becomes important, that you want to choose a plan that takes into account your finances.
Right.
And that's not always the case, right? And then just also looking at plans overall, choosing a plan based on your lifestyle. Because do you travel, or are you in one place?
Right.
So you want a plan that reflects your lifestyle as well as your finances and long-term goals. And then I think the last one is choosing a plan because you're healthy today. Just because you're healthy today, you want to look at your plan for 5 years, 10 years out, because your 10-year lifespan of health may be very different. So we want to just have those conversations.
Right. Well, so that kind of ties into back to the major life events, like we said, retirement, downsizing, divorced. I guess how we talked a little bit about it, but I guess do you see a lot of emotions that ever play into that, and do emotions sometimes impact the decisions they're making when it comes to health insurance? Maybe it all ties back to just picking whatever's the cheapest.
Oh, when they're downsizing?
Downsizing or just any life change.
Life changes. I mean, you always have to take into account the emotions, right? Particularly individuals who are going through right-sizing and or a big move. There's an emotional piece there, right?
Yes.
You've accumulated so much stuff in this house, and you've let that go, and now you're moving to another home, unless you can put everything that was in that house in the new home.
Not typically,
Which
yeah.
my mother did. She put everything in the basement. Her old home was in the new one.
Right. Just put it
Because she
in a
couldn't
box.
throw anything away. I'm
Right.
like, Mom, what's up here? So it's important, to just to go at a pace with people, to understand that there is emotions, right, around those choices that they're choosing around their health care. And then, my job and individuals like me is just to listen to where they're coming from in those choices.
Right.
Yeah.
And you kind of touched on it, but when someone is I call it right sizing. I try not, downsizing is sometimes a negative connotation to that. But what are some of the considerations? Long-term care, I guess if someone is going into assisted living or a community, or when they are right sizing, I guess what are some things to consider?
Yeah, again, it's just the biggest thing is to consider your lifestyle. Individuals who like to travel, we live in a community here in Colorado where we have great weather, but still you have individuals that like to leave to Arizona, to Florida.
Yeah.
Does your health plan reflect that?
Oh, that's a good point.
Right?
Yeah.
Because what's happening in health plans today is if you haven't taken into account networks and hospitals and where you can see care in Colorado, we're having service area reductions. So the rural areas of Colorado are losing plans. So if you think, I'm going to go away from the city, I want to live in this rural area, and you haven't thought anything about your health care, you could be in trouble.
Oh goodness. Okay. Well, I've seen clients of mine too who do end up they spend half the time in Arizona or Florida or wherever, somewhere warm in the winter, and they end up coming back here for procedures or surgeries because the coverage is different state to state. So I've definitely seen that as well. In terms of timing, are there any timing issues or deadlines people should be aware of when it comes to enrollment or making changes to their health coverage?
Yeah, you always have the classics, right? We have our annual enrollment period, which is October 15th through December 7th. That's when anybody can change their plan, no matter what kind of plan you have. Even if you have a prescription drug plan only, you can make changes. And then just for the people who are on Medicare Advantage plans, they can make changes between January 1st and March 31st.
Okay.
And one interesting piece is that people with Medigap plans or Medicare supplemental plans, they can make changes at any time. However, they have to be aware that making those changes may have underwriting requirements.
Sure. They're underwriting. That's if someone's feeling overwhelmed, as we see in these types of transitions in life, overwhelmed, emotions are flowing, what are just the first 2 or 3 steps, the first 2 or 3 kind of bullet points that you share just for people to gain clarity in kind of choosing what their next step is?
Yeah, it might sound funny, but for me, when I get somebody on the phone and I can hear they're overwhelmed and they're not my clients yet, I actually say, let's just take a breath.
Yeah.
Because it's going to be okay.
It's going to be okay.
I know it's going to be okay because
Sure.
I have some tools, right, to assist.
Yeah.
So, and I think really just assessing where you're at. Sometimes you just have to ground, right? Oh, okay, this is the plan that I have.
Yeah.
What am I not comfortable with? What don't I really understand about my plan? What have I been avoiding talking about within my plan?
Right.
And then writing those things down, because we know the science of writing things down helps to exercise that emotion, right? And then getting in front of somebody like myself, not on the screen, meeting somebody who just wants to change your plan, but somebody who has been vetted in some way through your friends and family or associates that you feel comfortable with, that will sit down and talk to you and listen to you and let you walk through with you the issues that are within your plan.
Right. That's good. That's great advice. Taking a breath. I include that a lot of my in a lot of my materials. Just take a breath. If it's feeling over one piece at a time, one breath at a time.
That's right.
Yeah.
That's right.
And then what are some of the, maybe it goes back to that too, but what are some of the questions people should ask? What are the 1 or 2 questions that...
Do you mean just in general or just questions?
When they're choosing a plan.
Yeah, I think depending upon who you're working with. So, great question to ask any advisor or Medicare broker or agent is, are you a captive agent or are you an independent agent? Meaning, do you just represent this one plan or do you represent many different plans by many different carriers? Because that's very important. And, all of the plans are good and bad. Everyone always asks me, oh, what's the best plan, Adofo? And I'm like, the best plan is the plan that fits your need.
Right.
The best plan is the plan that's going to be there for you when you really need it.
Sure. Right.
So that's really the key, is making sure that you have that kind of alignment.
Yeah, that's good advice. Yep, it's not one size fits all.
No, it never is. It never is.
Well, I guess who do you typically help the most, and how can someone reach out to you with questions?
Yeah, so again, I help under 65 and over 65, but my core clients usually are people who are in their 50s. I help them actually start preparing. You might say, oh, that's 10 years earlier, but you need to have those conversations, right? Because healthcare is growing in cost and it's growing in utility. And what we know is 50% of the people over the age of 50 are going to use some type of short-term or long-term care need. Right. And so we're just talking right now about Medicare. And that's just the major medical. That's not taking care of any of the gaps that are in Medicare. Having those long-term care or short-term care conversations of how we're covering those, right? How are we going to help reduce these costs within this plan so that it's something that somebody can actually fit into their life?
Right.
That's the key. It has to be strategy, because if we come to it last minute, you're just going to take what you can get. And then pray that nothing happens. I hear that all the time. I'm just going to pray that I don't get sick. I'm going to pray that nothing happens. Yeah. Prayer works.
Right. Right. When I hear this, and I'm sure you do too. When people have corporate plans, they're the W-2 employee, and they have, my employer takes care of my insurance. Do you encourage people to still maybe take a look at that coverage and see if it is the best for them?
Yeah, if we're talking about the 65 group, I definitely do, because I've had members who I never know what the employer coverage is. I don't know employer's coverage, so I'll tell them to get their summary of benefits from their employer.
Summary of benefits.
Yes, the summary of benefits is key. You should always look at your summary of benefits. Two things that I would leave with your audience is summary of benefits and the annual notice of change. That summary of benefits outlines everything that the carrier is going to cover for you. And the annual notice of change outlines all the changes for that new plan year that the carrier is making within your plan. Okay. Those are two very important documents to have. But with those, you're able to actually navigate and understand what it is your plan's limitations are.
Sure. Okay. That's really good advice. So it's summary of benefits. Okay.
An annual notice of change. An
annual notice of change. Okay. Well, those are all the health insurance questions I have, but I always like to humanize my people, because we all have a personal life and things that we love, and it's just really great to get to know people on a personal level. So rapid fire, a few questions. Okay. Okay. Celebrity, or you've probably already met this person now that I'm thinking about it. But who is the celebrity or public figure you would like to meet?
Ooh, Brad Pitt.
Brad Pitt? Yeah.
He's just a cool dude.
He's always eating a sandwich in all his movies too. I'm just like,
kind of total bromance going with Brad. Yeah,
Brad Pitt. That's amazing. What was something people would be surprised to learn about you? Just a fun fact.
A fun fact about me is that I was on the first very episode of The Wife Swap.
What?
Yeah.
Okay.
To be continued.
Wow, I didn't know that. When did that air?
Oh my gosh, 20 years
20 years ago?
That's
been that long, that show?
It's been around. I don't know.
Okay.
It's a long time.
All right.
Little kids. Yeah.
Didn't know that. So there you go. Who has been, I probably didn't allude to this, but this is my Wingman and Wingwomen series. I like to call it's a collaboration, and you need to have a team to support you in these transitions. So who has been for you in your life a wingman or woman, someone who has just kind of always been there for you, someone who's inspired you in your life?
My younger brother,
Yeah.
Yeah.
Okay.
he's what I call my Theo, and Theo is Van Gogh's brother. The only reason we know about Van Gogh's life is because Van Gogh wrote letters that Theo's wife saved, or
Interesting.
we wouldn't know about Van Gogh's life.
Okay.
But Theo supported Van Gogh. So my brother, he supports me
Theo.
in all of my wonder and all of my creative, everything. He backs me. He's my Theo.
That's amazing. Okay. And then finally, my last kind of rapid fire here. I know you're a music person, as am I. So what is your, like, and I'll tell you mine too, because you'll probably be like, Tracy, you're ridiculous. But what is like your motivating music? Like, is there like a song that you're like, yes, this gets me pumped, or an artist, or it could be a couple too, but
well, Tribe, man, is
okay.
I always put on some Tribe, but I mean, there's probably a lot, but it's like for me, man, just to get into my groove, I'll just throw on some Tribe.
Tribe Called Quest.
Yeah,
there you go.
yeah,
Yes,
yeah.
love it, love that. Mine is always anything Meek Mill or Man on Fire, St. Elmo's Fire.
Yeah,
That's
course.
that one gets me going. So John Parr, there's a fun fact for you today. sings that song.
I didn't know
So
him singing.
well, that's all I had. So this has been amazing, and you're just a wealth of knowledge, and this is going to help so many people. So I know you just help so many people, and I really appreciate your time. And thanks for joining me today.
Well, thanks for having me into Tracy's audience. I want to let you know that I put together a Medicare roadmap, and we should have the link on there for you to click on for those individuals who just want some questions to ask of their plans. That's made available to you at no cost. And happy Easter coming up, right?
Yes, happy Easter, happy opening day. Phillies Rockies, so go Phils. Yeah.
Go Phils. I gotta say go Rockies. Go Broncos. There we go. Look at the colors.
Yeah, I think it is. It's
Bronco Nation's still in there. Yeah.
Thanks. Yep.